scenario: 45-year-old patient with a varicose vein. You have 6 minutes to take to do this examination and 3 minutes for discussion. Okay.
Okay.
Okay. So 6 minutes started.
Hello, I'm Dr. Muhammad. I'm the surgical working here. May I confirm your name and date of birth, please? And how old does that make you?
محمد رد لي وانت يا احمد.
Okay. Hello, doctor. Continue, please.
Hello, my name is Dr. Muhammad. I'm a surgical doctor working here. Can I confirm your name and date of birth, please?
Yeah, my name is Jack and I am 36 years old.
Today I've been asked to examine your legs vessels, which involve me having a look, taking a feel, and do some special tests. Is that okay with you?
Yeah, that's right. Yeah.
Do you want anyone?
No.
Do you want anyone to be with us in the room today?
No, doctor.
Do you have pain anywhere in your body?
No, I have no any pain.
Okay. I'm going to explain to you that the examination step a bit by a bit. I'm going to start by asking you to stand at the middle of the room, if you don't mind, please.
Okay.
Okay, Mr. Khalifa, now I'm going to have a look from the front.
Mm-hmm.
Now from the back. Okay, Mr. Khalifa, now I'm going to do a fine touch on your leg, taking your leg stimulation.
Okay.
I'm going to do another fine touch to take your tenderness. Let me know if you have any pain, okay?
Mm-hmm.
Okay, Mr. Khalifa, now I'm going to check the blood flow on your vessels, which involve me having a feel in your groin area. Is that okay with you?
Okay.
Okay, Mr. Khalifa, can you cough, please? Okay, that's okay. Okay, Mr. Khalifa, now I'm going to use this small device, which is called Doppler ultrasound. I'm going to place the tip of this device on your groin area to check the blood flow in this area. Is that okay? Thank you, Mr. Khalifa. Lastly, the last step, I'm going to ask you to lie on the couch. I'm going to raise your leg up to this level using my shoulder, and I'm going to ask you to swing your leg out of side of the bed and stand immediately. Is that okay? Please let me know if you have any pain at any time, okay? Now I'm going to place this tape around this place, okay? Can you swing your leg out and stand immediately, please? Okay, thank you, Mr. Khalifa. Thank you for your cooperation. Do you want me to help you for raising back your? Thank you for your cooperation.
Okay. You have 2 minutes. You would like to do anything?
2 minutes.
Yes. So
I would like to complete my examination by doing abdominal examination and BR examination and peripheral vascular examination as well.
Okay. So can you present your case, please?
محمد لا
5 minutes. Yes, I
محي
know.
الدين We'll give, yeah, I know. Let me just speak with the person you had examination with.
Yes.
شكرا لك يا ولدنا.
عفوا.
ما قصرت مع الزول ده، الشغل ده مسجل، عندك مشكله مع الكلام ده مع الريكورد؟
نهائي نشوف اي حته.
تمام، اوكي، let's continue.
Okay, Muhi, can you present your case, please?
Mr. Khalifa, 45 years old, who presented with symptomatic varicose vein. From inspections, reveals that there is change in his skin. There is a skin change, and there is edema on palpation. There is a tenderness on his right leg, indicate varicose hypertension, and a valve incompetence from the Doppler ultrasound and Trittenberg. There is a valve incompetence and deep venous obstruction. My differential diagnosis is primary varicose vein. And I would like to complete my examination by doing peripheral artery circulation assessment and neurological examination for the lower limb, and abdominal examination and digital rectal examination.
You say there is a deep vein obstruction.
Yeah.
Okay. So, what's your other differential diagnosis?
The varicose vein, primary varicose vein.
Okay.
Chronic venous insufficiency.
What are the causes of varicose veins?
There is a genetic cause for like age, gender, and family history, and there is a hormonal cause like a pregnancy, menopause, and a hormonal therapy, and there is like a lifestyle cause, the obesity or lack of the activity or prolonged standing.
Okay. And how important the Doppler assessment in your plan?
The Doppler assessment that is crucial for me to give to navigate the varicositis, and it will help me to guide me for the treatment.
So what's your treatment? What's your management for this patient?
So my treatment is going to be a conservative treatment, like compression bath, elevate the leg, exercise, avoid the prolonged standing, and there is a non-invasive as well, like a foam sclerotherapy or a laser ablation.
And what are the contraindication of stripping?
Contraindication of, and there is a surgical treatment for stripping or ligation. The contraindication is thrombophlebitis or blocked venous system.
Okay, and if your patient is taking oral contraceptive pills, what do you think?
There is a risk for DVT. This is why I need to refer him for gynecologist to give him progesterone only pills instead of taking oral contraceptive pills.
Okay, the last question in this station. Very nice, Dean. So let us review from the beginning. Varicose vein is not a difficult station, and it's the most common station recently for MRCS B examination. You start by introducing yourself, and you took permission very clearly and nice. You start by inspection, but in the beginning you said I have been asked. We train ourselves to say, I would like to examine your vein in your legs.
Okay.
And I need you to expose your both legs while maintaining your dignity. You should tell him that you need to expose him. And
No, right.
regarding the palpation, You showed me firstly that you palpate each leg alone, but you did it
Ahmed.
together at the same time.
Can I add one thing?
Yeah.
Muhi, this is very important. Through all the history, through all the communication, we never ever say I've been asked. We say I'm one of the technical doctor working here, make say your name and age, please, and then you take a permission.
Okay, no.
Don't say I've been asked. I know all the other courses provided, they say I've been asked, but that's not accurate. Yes, Muhammad.
Yeah.
Meanwhile, Muhammad, Muhi, can you call Umar and not Muhi? I mean, can you just call those Rahman? Give a quick call for those who are not here. Yes, Muhammad.
Okay. As I said regarding the palpation, when you check the tenderness, separate your performance of leg, then other leg. Don't do it at the same time. Okay. So you can
Could you again? Sorry.
regarding the tenderness, the palpation, check each leg alone.
Okay.
Yeah. And regarding the handheld Doppler, you should put the handheld Doppler and then compress the calf area. I saw you compress the thigh. Am I right?
Oh.
Okay.
Yeah. Might be
And
wrong.
yes, the special test you did it perfect and nice, but I saw you also hurry up. You surprise your patient to stand. And you need to push from distal to proximal, not touch, jumping touch. Push the blood from the distal to proximal. Then tell your patient, this is a table I would like to tie in your thigh. Then ask him to stand, look. After look, you should say thank you. You say thank you before it even release the tail. Okay, this will affect your mark of professionalism here, but you did the special test perfectly. Regarding the summary, you mentioned all the positive things and answer all the questions, but you forgot to mention the surgery management. I remembered you by asking you questions. So make sure that you mention all the steps of the management. Otherwise, perfect, very nice presentation.
Muhyiddin, not a bad presentation, but the small mistakes that you need to get rid of. Firstly, I wanted to present faster, ya Muhyiddin. There was a bit of hesitance and your presentation was not that perfect when you presented your patient with varicose vein. You stumbled while you presented. You should say it immediately fast as much as you can. Okay, doctor, can you just present your patient? You said, I examined Alex for whatever who presented with symptomatic varicose vein. Inspection revealed varicositis, skin change, and edema. Palpation confirmed warmth and tenderness, indicating venous hypertension and possible valve competence. You didn't say it this way. You said it in a different way, and it wasn't complete. You forgot a lot of what the Brody Glendenberg alongside Doppler assessment, what did it show? All of this, you should say them faster. You said, do you need? You said that do you want anyone with me on this room? That's not a wrong sentence, but do you need any chaperone? That's it. Do you need any chaperone? Don't make it complicated. Do you need any chaperone? It's not do you need anyone in this room or no. Do you want any chaperone? So you did the milking for your patient while he's sitting, and then you put the tourniquet. Did you ask him to stand and you took the tourniquet?
I asked him to stand. I didn't take the tourniquet. I just asked him to stand without taking the.
You asked him to stand without tourniquet, and nothing came down there.
Yeah.
That's going to happen on the exam. I just want to make sure, did you ask your patient to stand again? No.
After he went back, I don't know. I didn't get your question. I just did the milk for.
You did the milking on the opposite side to collapse the vein. You put the tourniquet while he's lying down. Did you ask him to stand? No.
Yes.
Yes, he asked him.
That's a single tourniquet test. There's another test called multiple tourniquet test. They will not ask you to do that on the exam.
Yeah, but I know how can I do it, but just in case, because you mentioned something on the video that there is a different label for the tourniquet. If there is a defect on somewhere, I guess I know how to do it, but I don't know how to detect the level to do it correctly if there is something wrong.
You will never know the level. You will just have an idea about where is the incompetence. The ultrasound Doppler and the CT venogram will show you exactly where the incompetence is. The tourniquet test and the multiple tourniquet test will just give you a rough idea where they need.
Is it above or below? Yeah.
All right. So in Muhammad video, did we do a multiple tourniquet test or no?
No more tourniquet test. But even about the level, I didn't get explanation.
And multiple tourniquet obsolete now. No one doing it.
Yes, because we do the CT venogram and ultrasound Doppler.
Yeah.
Okay. That's why they don't ask you about it. Then أنا نسيت إنه عندنا فاسكولار هنا. Okay, fine. Let him. You said it. Varicose hypertension. The Doppler assessment is. Muhammad asked you a question. He said, "What's the Doppler will benefit you?" You didn't answer this question, Muhyiddin. Just stumbled around. I don't think you know your answer. Muhyi. When Muhammad asked you the question, how does the Doppler benefits you? How you
assessment advance reflex وما بين الvaricositis ما بين for varicositis and guiding during the treatment.
بشوفك هسه ما اشوفك في الفيديو. In the recording which we have, you didn't answer the question. You just.
I was in the stress because I was thinking about the next question. What is going to be that I need to re-memorize before asking me the.
Yes, but overall, you will not fail this station. I forgot even to do the Doppler in my exam. So don't forget the Doppler. The Doppler, nobody will tell you about the Doppler. The Doppler will be on the back side. Nobody will tell you there is a Doppler. The Doppler will be behind the patient. You should say, I need is there any Doppler around here? You should ask for the Doppler. But overall, that's a good performance. You just need to memorize exactly. Memorize. You know what we written in the school? Memorize it.
Yeah, but okay. But about the positive things, if I just mentioned them,
you're gonna receive. We mentioned all the positive that you're gonna see. All these things.
Even if there is no edema or if there is no tenderness.
No, if there is no edema, you're not gonna say them. But Muhyiddin, what's your presentation? You completely missed a lot of important points. When you memorize this one.
Okay.
When you memorize this one on your exam day, you can add the positive and remove the negative easily. But you have to have like a baseline of what you need to memorize. Okay. All right.
But thank you.
Yeah, but overall, that's a very good one. Yeah, very good one. Keep it up.
Okay.
Doctor, I want to ask about the tourniquet. So I make the patient stand up twice. Once when the tourniquet is on and once after I remove it.
You don't need to ask the patient to stand twice, Habiba. Just push the blood from the distal to proximal, then apply the tourniquet, then ask the patient to stand. Then after 10 seconds, remove the tourniquet and look to the blood, the pushing of the blood down. Yeah.
Thank you.
Dr. Ali?
Yes.
I need to just for tenderness.
Yeah.
He just palpation for both legs, and he did at the same time, which is good. And he needs also to make for the saphenous vein for the small and the great saphenous course. He did only for the small one. Yes.
It is the lateral, you mean?
Only the lateral and the medial. He make it both at leg, so this is not good.
You mean he didn't examine both legs?
Yeah, he did. He did.
I mentioned.
And for saphenovarix, he should make the thrill also. Very important.
He said the cuff. He said the cuff. He said
yes, he did. She make the thrill and tenderness.
He touched it or no?
He didn't make the thrill. He
Okay.
didn't make the thread.
Okay. So, Muhyiddin, on that's not just for varicose vein, for as a medical basic guideline. Examining this breast, you should look for the next breast. If you're examining this hand, you should look for this hand. If you're examining this feet, you should look for the other feet. When you examine the hand, when you examine you touch the
Saphenofemoral junction.
saphenofemoral junction. But just make it clear for the examiner. I'm checking for any vibration around this area. Just make it this way. Say it. So know that you're checking the thread. And I just want to explain for everyone the idea of the tourniquet test. Correct me, Muhammad Sadiq, if I'm wrong. So you milk your patient will have varicose vein. Let this is like there's varicose vein everywhere. You milk all of it this way, and then you put the tourniquet. You ask your patient to stand. If your patient stands and you already block the saphenofemoral.
ممكن ان احنا نعمل الزول اللي داير يشتغل السيشن ذاته
I
يعمل
am
ريكورد
recording now يا علي. I am recording.
اديه الاذن بس.
خايف انه بعدين ما يظهر.
ايوه
خايف بعدين ما يظهر لاني اعمل. خايف بعدين ما يظهر، فهمتها؟ خايف بعدين ما يظهر.
I am recording now here.
خلاص طيب نطلع ونخش ثاني يا محمد. انت
علي انا شغال اعمل ريكوردنج بس حاليا يا علي.
ما قلت ما تصلح، انت قلت المشكله. You said the problem is not solved. You didn't tell me the problem is not solved.
ايوه ممكن يجيب بس حاليا ما اعرف. اللابتوب ده يطش عادي.
لا are you recording or not?
Yes.
Okay, let's do it then.
طيب ما في مشاكل.
Okay, start or
ايوه الارتيريوس فيستولا.
no. قاعد peripheral vascular disease.
peripheral artery examination.
ما صوتك بقطع يا محمد.
اللابتوب معلق يعني. اللابتوب مشكلة معي عليه.
خلينا نطلع ونخش ثاني في سيشن. طيب خلينا نطلع وخلي اللابتوب يظبط.
ما حل المشكلة. طيب الآن من اللابتوب لأن الطريقة بتاعته وقف تعديل فيها.
اوكي ستارت يا محمد. محمد
Yes. طيب سيناريو 65 years old male ex-smoker present with intermittent claudication in the right lower limb. You are asked to perform a peripheral artery examination and interpret your findings. Assistant to do this examination 3 minutes of session.
محمد صوتك ما ظاهر. اوكي I will do it. صوتك fix let your computer relax for a bit. 65-year-old male ex-smoker present with intermittent claudication in his right lower limb. You are asked to perform peripheral arterial examination and interpret your finding. Perform peripheral lower limb arterial examination, include relevant special tests, and discuss your finding with your consultant. You can start now. Muhammad, put the timer, please. Start.
Okay. Hello. I'm Dr. Muhammad. I'm one of the surgical doctors working here. Can I confirm your name and age, please?
Hello, doctor. Yeah, continue, Fatah Rahman.
I'm John. I'm 65 years old.
Nice to meet you, Mr. John. So, Mr. John, today I will be your doctor and I want to examine your both lower limb. This examination involved me to take a look to your lower limb, to touch it, and to do some special tests. Is that okay?
Okay.
Okay, perfect. So first, Mr. John, I will take a close look to your foot. Okay. Okay, now I will touch to check your temperature. I will look between your toes for any ulcers or any hidden toes injury. Okay. Okay. Now I will check, Mr. John, your peripheral pulses. Okay. Now I would press against your knee also to check the popliteal pulses on the upper limb. Now I will check your femoral pulse, sorry. Now I will check to compare between your upper limb and lower limb pulse, femoradial, if there is any delay. Perfect. Now, Mr. John, I'm gonna to use a stethoscope, and I want to listen to your pulse in your abdomen and your groin, okay?
Okay.
Okay, perfect. So now, Mr. John, I need you to relax. I will raise your leg, okay? And after that, I will tell you what you will do, okay?
So,
If you feel pain, please let me know. Okay, now just we'll make it down. Perfect. It's about 30 degrees. That's good. Now, Mr. John, using this piece of cotton, it's the sensation is like this, okay? I need you to close your eyes, and if you feel it, tell yes. Okay? You feel it?
yes,
You feel it?
yes,
You feel it?
yes,
You feel it? No.
yes,
You feel it?
yes,
You feel it? No.
no.
Okay. Thank you, Mr. John. I'm finished from my examination. I will discuss this finding with my consultant. I will get back to you.
All right, doctor. Can you present your patient, please?
Yeah, I did lower limb arterial examination to my patient, John. He's 75 years old, present with intermittent claudication. On inspection, there is obvious paleness and dark in his peripheral toes, as well as the peripheral pulse is I didn't feel it, is impalpable. Also, there is regarding temperature, it is cold right foot in comparing to the left. There is palpable femoral pulses and no pruit, as well as there is no femororadial delay. Also, I found that on inspection there is loss of hair in his calf. My concern is that, considering this finding, this patient suffering from the chronic lower limb ischemia.
All right. What's your differential diagnosis for this patient?
Yeah, this patient could have chronic peripheral arterial disease, critical limb ischemia, or Raynaud's phenomenon.
What else?
Also, it could
If you
has
let me make it easier for you, if you have a dry gangrene,
yeah, critical limb ischemia. I mentioned it.
okay, if you have a dry gangrene with auto amputation,
Yeah, critical limb. This patient has chronic limb ischemia. The differential chronic limb ischemia, critical limb ischemia, or Raynaud's phenomenon.
yeah, but if it's if it's if it's dry gangrene, black one, and there's auto amputation of let's say the lower limbs and the upper limbs.
Berger syndrome.
All right. And what is your how do you define critical limb ischemia?
The critical limb ischemia is presence of chronic limb ischemia and patient develop breast pain or tissue loss.
Tissue loss, yeah. In what further investigation would you request?
First, I would complete my examination to do a full neurological lower limb examination and vascular upper limb as well. Also, I would consider arterial Doppler ultrasound, CT angiography to the lower extremities. And if patient had any renal problem, I would change it with MRA magnetic resonance angiography.
Yeah.
And also regarding the blood investigation, I would consider bleeding profile, lipid profile, full blood count, ESR, CRP, and blood glucose as well.
All right. And how will you manage this patient according to the presentation that you can see now?
This patient first, I will try with him as he didn't complain wrist pain. I would approach him conservatively. I would encourage him to do regular exercise and smoking cessation. Also, to reduce the fat intake. And I will prescribe some antiplatelets like aspirin or clopidogrel, like modification of his lifestyle in general.
What else?
I will go then, if the things goes worse, I will consider surgical intervention. It's according to the location of the occlusion. I can consider bypass surgery or thrombolysis, or even if the limb become unsalvageable, I would consider amputation.
All right. Fine. If the patient insists the pain is from their hip and asks for hip replacement, how would you respond to such a patient?
Yeah. First, I will assure him that his concern is valid. I would explore his concern, and I would do more orthopedic examination, like specifically hip examination. But I will tell him the same time that the finding on my clinical examination is more fit with peripheral vascular disease. And also I would take opinion of orthopedic.
All right. Okay. This is the end of my questions.
Okay, thank you.
All
So, you have, I think, 4 seconds. Very nice presentation, Muhammad Sadiq, the master of the station, of course, was also from the beginning. You're starting by look to the patient legs.
Muhammad,
But can I ask you?
Muhammad, there's a problem with your voice. Do whatever you do.
طيب كده كيف؟ أنا سامع كويس لكن أنت ما سامعني كويس؟
بقطع صوتك.
طيب كده كيف؟
Yes, better.
طيب, excellent presentation, Muhammad Sadiq. Can I ask you, did you check the hands of your patient? Think you have 2 minutes remain. Yes, the session about the peripheral lower limb arterial examination, but we check the hands for nicotine and for the capillary fill time also. You inspect the leg, yes, and if you have no pulse, you should consider handheld Doppler, right?
Yes.
Yes. So,
if in exam there was no pulse, I have to ask for Doppler or just mention it?
Ask for Doppler. You should ask for Doppler. And also, you should do the ankle brachial pressure index. In the peripheral artery examination is mandatory. I saw you didn't mention the ankle brachial pressure index.
Yes.
Also, regarding the special test of Berger test, we did it for one leg.
Yes.
You will find your patient on the couch, so you need to do the both legs.
Even the normal leg?
Yes. Not like the varicose vein.
I know
And
Muhammad Sadiq from I know from if I'm doing the vascular ward round now, and I have someone and I see the right leg is completely viable and it's completely normal, you would think as experienced doctor that there's no need, but it's just for the exam technique. It's just the stupid stuff that you need to do for the exam, because just to show your examiner you are examining the. They don't treat you as someone who has vascular experience. They treat you as someone who is moving from CT2 to ST3. So it's a very junior exam. That's why you do both. Okay.
Okay. Perfect.
The only thing I cannot do for both the varicose vein and the fistula Regarding peripheral artery examination, we need to do it for both legs. Also, Kabir, fill time for the lower legs. Otherwise, you did all the steps of the examination perfectly and the very good test, and you answer all the questions of the discussion. Very nice, very nice presentation, Muhammad Sadiq. It's of course pass for the station.
All right, Muhammad Sadiq, that's a very good one. That's very good focus one. It's just the small points Muhammad just mentioned. Do the burger for both legs, even the other leg is viable. You just doing it to show your examiner that you know that you need to compare both of them. I know that the treatment is very more specific than what we just said, but on your exam they just need you to know the general stuff. And also one suspected question which I asked you before is what the difference between chronic limb ischemia and critical limb ischemia. If you can say that again.
Usually the patient of the chronic limb ischemia.
In English.
The patient with chronic limb ischemia, when present with acute symptom, we call it acute on top of chronic. Okay.
Yeah.
That mean what you have. That mean the patient develop breast pain, like patient he was already claudicant for many years, and suddenly known as chronic limb ischemia and live with this. So sudden onset of breast pain or tissue loss like gangrene or wound in his toes, this diagnosis will be critical limb ischemia or acute on top of chronic limb ischemia.
All right.
So by definition, by definition, the critical limb ischemia means chronic limb ischemia plus tissue loss or less rest pain.
Yes, completely right. This according to the UK guideline and NICE guideline. The American guidelines add another third
ABI.
code. Yeah, ABBI. If the ankle breaker pressure index is less than 0.4, then in America they also consider it as a critical limb ischemia. But this doesn't apply to UK. So this doesn't apply to the guideline of USA. So that's why, Muhammad, I'm just going to remove it now because this is not a USMLE exam. This is MRCS. ABBI is not considered here in UK. It's just the two tissue loss or rest pain. And by rest pain, we mean that the patient is pain at rest. He doesn't need to move. He doesn't need to move before the rest. We have what we call claudication distance. Claudication distance means how many kilos are you able to walk before you feel the pain. If you are able to walk for 10 meters, that means your claudication distance is 10 meters. If you are able to walk like a kilo, that means your claudication distance is a kilo. And this is very important clinically because this will determine will you do angioplasty, will you amputate, it's very important, the claudication distance. When we say pain at rest, that means your claudication distance is 0. You feel pain before you move. All right? Fine, Muhammad. I think we have the last station. Fistula for Habiba. You can open your camera. Fatah Rahman, can you be her patient, please? Like, just put your hand this way. And maybe just try to swelling on your hand or whatever with a pen around your swelling, around your arm.
Doctor, before I start, can I ask about the ankle breaker?
Yes. Yeah.
How I will do it? I will measure the pressure and the brachial and
ankle brachial index. Okay, so ankle brachial index is
في كف مع نفس جهاز الضغط. في كف وفي مع بتاعت الهاند هيلد دوبلر بتخدها بعدين بتحسب مع ضخه بتاعت مع البلد بتوريك البريشر بتاعه بالضبط وبتعملها في البريكل في الهاند فوق.
باختصار يا حبيبي محمد صوتك بيقطع. let me explain. You measure the brachial and you measure the ankle. You put the systolic of the brachial above and you put the systolic of the ankle, and by the ankle we mean the dorsalis pedis. not the dorsal split, it's posterior
أي
tibial
واحد
or
فيهم
anterior tibial.
أي واحد
Yes.
أنعنه فيهم
You put the
نعم.
systolic
بتعمل
and
الاثنين هنا
you
والاثنين
put
هنا
them on top of each other. Then you will receive a number. If your number is between 0.8 or 0.9 to 1.1, according to different guidelines between America and UK, that's normal. If it's above 1.4, that means the artery is calcified. If it's 0.8 to 0.6, that means mild peripheral arterial disease. If it's 0.4 to 0.6, that means moderate. If it's less than 0.4, that means severe peripheral arterial disease. You don't need to know all of this. You just know that you measure the brachial and you measure the posterior tibial or the anterior tibial of the ankle, which one is above, which one is highest. You put the systolic. You don't care about the diastolic. The systolic of the brachial ankle. Do you understand it now, Habiba?
Yes,
Yes.
yes.
You
The
can
cuff
also
of the cuff of the brachial is يعني special cuff اللي هو the same زي
no. It's a specific cuff for the feet, and if for whatever reason you are not able to take from the posterior or anterior tibial, you should do the what we call ankle. No, we call it brachial toe index. That's the other one, brachial toe index. You measure the blood pressure of the big toe. Can you imagine that if your patient has no pulse on the posterior tibial, we call it ankle toe index. But all of this is detail that you don't need to know.
But Dr. Ali, do that we agreed that ankle brachial plexus doesn't exist anymore. We don't want to do it or
No. In your exam, you don't do it not to do it. But in real life, that's the very thing you will do to determine if the patient has.
it is subjective. It is important. Yes.
to do it.
Do it.
In your exam, you don't need to do it. But in real life, you will do it.
Okay. That is exactly what we need to do.
All right. So should we move to the last station?
Yes. Habiba.
Yes.
Let me in Habiba. طيب. Scenario. 50-year-old man with chronic kidney disease presents with blue discoloration of his hand and upper limb overnight. Is known to have a functioning arteriovenous fistula for hemodialysis. Perform a detailed examination of the arteriovenous fistula and the upper limb. Okay.
Okay.
Muhammad, your voice is still just try to speak slowly because of
لا
your voice.
بشتغل كويس لكن ما اعرف في مشكله في اللابتوب بس.
Okay, Fatah Rahman, you are the patient, okay?
So 6 minutes started.
Okay. Hello, I'm Dr. Habiba, one of the surgical doctor here. Can I confirm your name and age, please?
I'm Edward. I'm 57 years old.
Your name?
Edward.
Okay, Mr. Edward. Today I will be examining your hand. I will your hand and chest and okay. Now I will be listening. Okay, I will be listening to this place, and I will be listening to your heart. Okay.
Okay.
Okay. Thank you, Mr. Edward. You was very cooperative with me. Thank you. I will
Thank you.
discuss the results with my consultant, and we will get back to you.
Okay. Thank you.
All right. You still have a couple of seconds. What do you want to do? Muhammad,
Okay.
are you here?
Yes.
Yeah. How many seconds she has?
2 minutes. 2
I
minutes.
think I forget things, but I cannot.
You
Yeah,
have
you
2
have
minutes.
you have 2 minutes to remember. Just
If you
try
would
to
like
calm down and see what you're gonna do.
should we go to the discussion, Habiba?
Yes, can go into discussion. I don't think I'm gonna remember anything. Yes, doctor, go ahead.
You can present your case, please.
Okay, so I took history for Mr. Edward. He is 50 years old. He has lower discoloration on his hand. I don't know if there is any finding I should say or
Continue, please.
Just say your
Continue.
finding. Yeah.
okay. I can
Treat it like one of the two causes. Just choose one and go with it.
Okay, I can feel the peripheral pulsation, although I can feel a thrill on the fistula, on the blush discoloration.
All right.
Okay.
So what is this finding consist with?
Arteriovenous fistula.
I mean one of the complications of arteriovenous fistula. Do you know what is it?
I don't remember the name now.
All right. What are your differential diagnoses then for the complication of arteriovenous fistula issues?
Ischemic.
Ischemic what?
Ischemic menocolic.
Okay.
And neuropathy.
And what else?
I don't remember. Can we pass this?
Okay. The second question will be how you can differentiate between the two conditions.
Okay. For the one with the ischemia or with the blocking of the blood flow, I will not feel the pulse. I will have cold periphery. The capillary refill might be increased, but if it's more neurological, I will have sensory deficit, which is the other symptoms will be okay. I will not. I will have pulsation distally.
All right. And what investigation will you request?
Investigation. Okay, I need to do Doppler, CT angio.
Okay.
I want to do blood examination and blood investigation, like urea creatinine, complete blood count, and maybe I will need to do MRI angio also.
And what else?
Dopplex. He said Doppler. I want to make sure the heart also is okay, so maybe ECG and
All right. What treatment options available for your main diagnosis, which is dialysis ischemic steal syndrome?
okay. I have
Time, but
conservative.
continue.
I have conservative and surgical. The conservative is compression. Cannot remember. I'm sorry. Compression, and the surgical would be revascularization and ligation of the fistula.
What else?
Okay. There is another surgical option called drill,
Yeah. What else?
and
What else?
maybe a bypass in the fistula or make another fistula and occlude this one. I don't remember, I think.
Okay. That's all right. So the time is already finished. Okay, Habiba. Look, I will accept everything, but I wouldn't accept you not memorizing what we already written.
Yes.
So for how many, like when did you start this recitation? Did we surprise you today or you already studied it?
I studied, I think, 2 days ago. Yes, 2 days ago. So
All right.
today I didn't have time to recap.
Yeah, but our plan is to make sure that if you study at least once, you will
Yeah.
just be remembering it. The
Yes.
most, like okay, your performance, I'm not happy with it today
Okay.
because you forgot the main point of discussions. Let's say if you examine the fistula badly and you didn't take for the fistula, that will not affect your mark much because even the examiner may not be looking at you. And if you just know, hello, my name is Habiba, that's a mark. Can I confirm your name and age? That's a mark. I will be your doctor for today. Are you okay for that? That's a mark. You already took 5 marks by just saying the first line. Okay? But you will lose all the discussion because you don't remember the differential diagnosis.
Yes, yes.
All the discussion you will lose it because you don't know what's your main diagnosis. Not you don't know, you know it, but you don't remember what is your main diagnosis and what is the differential and how to differentiate between both. And even when I ask you what's your treatment, you answer what is your investigation, you answer this question right. But when I say what's your treatment, you will treat me according to your differential, right? And you investigate according to your differential. I'm not saying you're gonna fail the station. I'm not saying but you're gonna miss a lot of mark, Habiba. You're gonna miss a lot of mark. So make sure fistula is becoming more common. Make sure you memorize, especially the 2 differential diagnoses, which are dialysis ischemic steal syndrome and ischemic monomelic neuropathy. You should memorize these 2, and you should also memorize the feature of each one and how they differentiate between each other.
Okay.
All right. It's not the discussion is very simple. It's just 2 or 3 questions.
Yes, I know.
Yes. Yeah. So look, what I want you to do, Habiba, I want you to record for me. You open a school and you record. You open your phone and you record a 50-year-old man with chronic kidney disease presented with. You record all what we say, including the discussion between the examiner and the patient.
Okay.
And you send me this record.
Okay. On school.
Today.
Okay. Yes.
All right.
Okay.
Muhammad?
I am very sorry I lost my internet connection. I didn't tell your performance, Habiba, but I would like to ask you, did you do the arm elevation test, argumentation test, and flow direction test? This honestly, did you need?
Yes, arm elevation on inspection. Augmentation, I just press above and feel the pulse, right? This is the augmentation.
Augmentation, you should compress the fistula proximally, near side of the fistula, and then check the radial pulse.
Yes, the fistula itself or proximal to the fistula?
The fistula, proximal side to the fistula. Yes.
Okay. And the last one was?
And the flow direction test.
Yeah, I just put my hand on the fistula and try to feel the
behind. Yes, in the both direction. Is the blood flowing in the right or left?
Okay.
Yes.
Yes, I do.
Just watch the video a couple of times and practice this session again. But your performance overall nice, but you need to memorize all.
Muhammad. No. Her performance today, I'm not happy with it.
Yes.
Habib always perform way better than this. So please, I want you to read it carefully and memorize it. And I'm waiting for your record before you go to sleep.
Yes, inshallah.
All right, okay. Muhammad, I'm in the hospital now.